Lyons with Advanced Chiropractic and Rehab, and I want to talk to you guys today about the three most common causes of headache pain that I see in my office. I quite frequently get patients in for headaches. It's actually one of the conditions I enjoy treating the most because when we do get headache patients, we're usually really good at identifying exactly what the cause is, and when we do, we generally get really good results really rapidly. Most headache patients we see will get relief on the first visit. Identifying the type of headache you have is first identifying what caused it to begin with. So we're usually pretty good at keying in on what the cause is. Headache pain can result from many different things, but the most common one we see is usually a past history of some kind of trauma. Motor vehicle crashes tend to cause a lot of ligamentous injury in the cervical spine, and even if you've had one in your distant past, that'll alter the way your neck actually functions, and that is typically one of the most common causes we see of somebody who's suffering from chronic headache pain. The second, or probably the leading cause, is sitting. Sitting for prolonged periods of time alters the mechanics once again in the cervical spine. It creates a flexion type posture or a forward head posture, which will cause a lot of the postural muscles in the neck and upper back to break down. This again leads to poor mechanics of the cervical spine, which radiates out as headache pain. And to follow that up, for the third most common reason I see headache patients, text neck, which you've seen or heard of. It's becoming more prevalent, especially in our younger populations. And this is where people are always looking down at their electronics, and they start to develop some of that forward-leaning posture, which is tends to be a problem. So what's interesting about headaches is when I get headache patients in, migraine headaches, the leading cause of migraine or true migraines are usually some kind of chemical trigger, and the most common one I see is hormonal. That is it's a much different animal, and it's usually not the type of headache that we see in our office. If I have 10 headache patients come in that say they have migraines, maybe one or two of them actually have a true migraine. So distinguishing the difference between what we would consider a cervicogenic mechanical type of problem creating headache pain versus one that's a vasoconstriction or spasm and that causes blood flow restriction to the brain, that's going to have a much different treatment approach. So getting the proper diagnosis is really important with headaches, which brings me to another point. I get all the time people who think that they have, or people with severe headache pain who think they have something wrong with their brain. And it's interesting because in 20 years of practice, honestly, in the absence of trauma, I've yet to see any significant findings on a brain MRI. Most headaches or most brain problems do not stem from an organic brain lesion, and a lot of times headaches not even a real common cause. So, but either way, it's really important to see somebody. It's really important to get a proper workup on the headache and make sure that it's not something more serious. If anybody would like some more information, you feel free to give us a call or look us up. And if you find the information in this video useful, we appreciate it if you like it and share it. There'll be a follow-up to this for treatment, and treatment options for headaches will be on the next video. Thank you.